I'm Dr. Sarah Bone.
And I'm Dr. Lisa Tartaglia.
And what we're going to talk about today is we're going to talk about capacity and capacity determination as it relates to complex medical decision making. Capacity is the physician's interpretation of the patient's ability for complex medical decision making, understanding what their situation is and making a decision that is going to be right for them.
Mm-hmm. Capacity is not the same as competency. Competency is determined by a court. It's a judge. A judge makes a legal decision or a legal determination regarding a global assessment of the patient or of the person.
So competency is more for money-related things and finances, and we like money. Don't get me wrong, but we don't make decisions about how a patient is going to spend their money or invest their money. That's a court. That's a legal decision. So the O in competency is like the O in money, and we deal with capacity. Capacity refers to the ability for complex medical decision making, and it's a functional assessment regarding a specific medical decision. So it's not a lasting pronouncement, and it can actually wax and wane. It can kind of come and go.
Yeah, so each time there's a complex medical decision that must be made, a physician has to consider the patient's ability to make the decision. If a patient lacks capacity for a complex medical decision, and is unlikely to regain the capacity, that's when the healthcare team will invoke or involve the healthcare surrogate. We have done several videos regarding healthcare surrogate, and they will be linked in our description box.
So to learn about that, because that's a little bit different, you have to kind of not have that capacity, and then the physician needs a medical decision made in a timely manner. That's when we're going to involve that healthcare surrogate. We're always going to ask the patient first, but if for some reason there's an acute medical condition and the patient doesn't have that ability and we need a decision made before it's likely that patient's going to regain that, that's when we're going to talk about that or talk with that healthcare surrogate about that decision.
Right. There are 4 components to be considered in the evaluation of capacity. Understanding.
The patient has to be able to understand that information. So we need components of memory, their attention span, as well as their intelligence for being able to grasp that information. So they don't have to have a high intellect necessarily, but the responsibility of the physician is to explain what's happening in terms that the patient can understand, and that's on the physician. They should be able to break it down into common terms so that the patient can understand, and they don't have to have a college degree or necessarily even a high school degree to be able to grasp that information, as long as their intelligence is sufficient that they can understand the information.
Right. There also has to be an appreciation, so they have to be able to identify the illness, the treatment outcomes, and the likely outcomes. Appreciation lack is typically related to denial-based intelligence.
So sometimes they don't appreciate the severity of their illness.
Yeah,
and sometimes we'll say they're a river of denial, because they don't want to believe what's happening is really happening. And I understand that sometimes that's extremely difficult, because you just can't believe this has happened to me. I didn't do anything to deserve this, but sometimes you have to get past that to just at least get to the point where this is what's happening, and now we need a decision made.
Yeah, and it's really important to meet the patient where they're at and just keep probing and discussing their disease with them so they're able to lessen their denial.
We also have rationalization or reasoning, where the patient needs to be able to explain back why or why not that they are making the choice that they're making. So that could be adversely affected by mental health issues or neurocognitive issues, but we've got to be able to have that rationalization, have those reasoning skills of the patient.
To help make the decision. Communication plays a role. Patients need to be able to express their choices of treatment. Some patients, even if they're nonverbal, they might be able to communicate on a notepad if they have ability to write, some type if they have a neurocognitive problem that prevents communication. Their rationale, if they're allowed to make changes in their decisions and their choices.
But we need them to be able to communicate that. So those 4 things are really what we require to determine if the patient has the ability for complex medical decision making, and that's what capacity is about.
Yeah. There's several myths related to capacity. People really view it as all or nothing. That there is also a formal test involved, which is not true.
Mm-mm. We need them to be able to be able to understand and communicate and reason that information out. But it's not a formal test, or it's not a written test or a verbal test. But we need to be able to assess that patient's ability to understand and interpret that information.
It's definitely not interchangeable with competency. Competency is a totally different entity than capacity.
Capacity evaluation is not necessarily required if a patient is, making a decision against medical advice, but depending on what that advice is, that the patient is declining that, it may require that physician and team to evaluate, does this person have that capacity for that decision?
Right.
And deciding against medical advice doesn't mean you don't have capacity. You may have good reasons for making that decision.
Exactly. As we stated before, it's not all or nothing. Capacity is not all or nothing, and it's not. And it is static, so it can wax and wane and change.
Yeah. So you might have capacity in the morning, and then you receive a medication at noon, or your blood pressure drops low at noon, and so it maybe in the afternoon you don't have capacity. But then maybe later on in the evening you've had a sleep, you've received some medications for infection, or your fever is down, and now you've regained capacity for a particular decision.
Right. You do not have to be oriented to person, place, or time to have capacity.
And cognitive impairment doesn't necessarily mean that you have no capacity. If I believe that I'm Martha Washington and my husband's name is George and we're in the 1700s, but you tell me that I have a malignancy and you want to take me to surgery and you want to give me chemotherapy, I may be able to tell you why I do or do not want that procedure. And it doesn't matter that I'm not oriented to myself or the year or the time, because I can tell you, I understand about the surgery and what you want to do to me. I understand about the chemotherapy and the side effects, and this is why I want or don't want that. So that kind of orientation of person, place, and time is not part of the capacity determination. It's that a person's ability to understand, interpret, manipulate that information, and then explain back why they've made that decision.
Exactly. Psych patients, there's a misnomer that they could lack capacity. Institutionalized patients have a lack of capacity, which is not true. Even if a patient is residing in an institution, or even if they have mental health issues, they still can have capacity to make their own decisions.
Misinformation doesn't necessarily interfere with the patient's capacity if we have provided the information correctly. So the misinformation, if we didn't give it right and the patient can't understand it, certainly that's going to affect their ability because we didn't give the information correctly. But that's not on the part of the patient, that's on us. So we need to be able to provide that information correctly.
So we really need to be able to explain the information so the patient understands it in their terms. Other issues that affect capacity are infections, medications, patients that are more fatigued or tired it could happen because of infections, because of medications, mental health issues such as depression,
hopelessness, all those can affect a person's ability for their logic capacity. Yes. And so if you've got somebody with an acute infection or a high fever, they may be delirious.
Right.
And once you treat that infection, their capacity may return. So if a patient's been sick and hasn't slept, or their pain has been so severe that they can't rest, then they may have problems with their capacity until you treat that underlying problem. Now, if the medication is what's making them too drowsy and they lack capacity, then you've got a side effect of a medication that's interfering with it. So you may have to wait a period of time until the effect of that medication is passed and they can regain capacity.
And usually what we try to do as physicians is have the patient talk back what they understand. So we ask a lot of open-ended questions like, what did you understand of what I just described to you about your illness?
I always kind of have a problem with this because I feel like I'm quizzing the patient, and I don't want it to come across that way. I want to have a dialogue with the patient so that they talk back with me. It's not really a test. Tell me what you've heard.
Yes.
Tell me what you understand about your disease. Tell me what I do want to know, what have you heard me say, so that I can know that I did explain it correctly.
Mm-hmm.
And then if I didn't explain it correctly, I want to know where I misled you or what information I didn't provide, because that's going to help me in that capacity determination. Did I explain it correctly?
Right. And then sometimes if you ask the patient, what are your treatment options? Like, you can have them talk that back to you, of what they understand as their treatment options, and that will also help you understand their comprehension of their illness.
Can they tell me how the treatment's going to affect them?
Mm-hmm.
What's it going to do to them? I want to know. So you've got some treatment options. What can you tell me each one of these represents to you, and how's it going to affect you?
Yeah, and that's really important, because a lot of times it's quality of life versus quantity of life, and it's important. Every patient has a different idea of what they, how a treatment will affect them, and what they would like from their life.
How's it going to help you obtain your goal?
Mm-hmm.
So explain to me what your goals are, and tell me how this treatment is going to help you obtain that goal. Why do you feel this way?
Mm-hmm.
So they are open-ended questions, not yes, no. Do you understand? Is this what you want? I think that's really kind of one-sided information, and it does not really help the patient, and it doesn't really help us assess. Now, if it's not a complex decision, you've got an infection, here's an antibiotic pill, and I'll see you in a week and recheck
Right.
you. That's not really all that complicated. But say a patient's going to be admitted for a pneumonia, and they agree, yes, I'll stay in the hospital, and yes, I'll take your IV antibiotics. And then after they've been there for a few days, now we've learned that behind that infection that's in their lungs, now we find out that they've got a tumor hiding behind that lung pneumonia. Do you want to have chemo? Do you want to have surgery? What's that going to do to your lung function? What's that going to do to your pulmonary performance? What if you're oxygen dependent? What if you would have a stroke during that procedure? What if you would need to receive somebody else's blood? There are people who don't want to be dependent on oxygen. There are people who don't want to receive somebody else's blood. So we need to make sure that you understand those risks and those benefits, and the decision to receive the antibiotics and stay in the hospital is not the same risk benefit as receiving a surgery and receiving chemotherapy.
Exactly. And it's really important. This all requires a lot of time, and it's really important to spend the time with your patient, see them multiple times, not just in one visit, maybe revisit the topic again, because when they first hear the news, they may have some idea of what they would like. Their disease may progress while in the hospital, they may improve. So just always revisit it.
So we want to assess that ability to reason, weighing those treatment options, and express it in conjunction with the quality of life that the patient finds acceptable and what their goals are. We want them to be able to express their goals of care. We want them to be able to demonstrate understanding for risks versus benefits and the outcomes of a particular procedure, because it's variable.
Yeah, and you also want to make sure that they're able to interpret the significant information and the relationship of the circumstance related to that information. We want the patient to be able to evaluate, deliberate, and mentally manipulate the information.
So in summary, there are 4 basic components to evaluating a patient's capacity for complex medical decision making: the understanding, the appreciation, the rationalization and reasoning, and then their communication. And if a patient can demonstrate those things, which really is very straightforward, it's not hard, it's not a test, we want to just make sure that the patient has the ability to understand all of that information when they make that complicated medical decision making. And they may not have full capacity, but they may have some, and they may want to ask their family for assistance. We may not have to use the healthcare surrogate for all of it.
Right.
It can be a blend. So what we want is to make sure we have the patient's best interest at heart, and we don't trick them into getting something or not getting something that they might want or might not want.
Exactly. And the big thing is to have the patient's interest at heart, and also to make sure that it aligns with what they believed or what they wanted before they were ill.
So if you have questions or comments, you're welcome to leave them below or send us an email. We want to tell you we appreciate your time today.
Yes, thank you for joining us and have